Most people with high blood pressure don't feel anything. No headache, no dizziness, no warning, nothing. This is just an everyday life, no indications that there's high blood pressure. But that's not reassuring. That is the problem. High blood pressure is called the silent killer for a reason. Today we're going to be talking about high blood pressure, and I'm going to explain to you what high blood pressure is and why it is important to take care of it. I'm Chelsea Asante. I am a board-certified family nurse practitioner and the owner of Orchid Wellness, a primary care and wellness clinic, serving patients personally in the DFW area and virtually in Texas, New York, Virginia, and DC. High blood pressure is one of the most common conditions that I see in my practice. I have patients anywhere from 18 years old to 94 years old that suffer from high blood pressure. And when I explain high blood pressure to my patients, I use an analogy that I'm going to use today to explain it so that it is easy for you to understand. So let's talk about high blood pressure. We have two walls, chicken wire and concrete wall. The goal is to push the wall forward and allow things to go through this wall nice and easy. Behind the wall, we have a force that is pushing the wall forward. In front of the wall, we have a lot of organs downstream. Okay, behind the wall, the force is the heart that's pushing the wall forward. The wall is the blood pressure. Okay, so for the chicken wire, it's nice and easy, right? It's nice and easy for the heart to push that wall forward, to have blood flow through that wall, and for the organs that are downstream to receive all the blood flow that they need for what they need to do their functionality. For the concrete wall, that's not the case. It requires a lot more energy, a lot more strength for the heart to push that wall forward, and for anything that should go through the wall to be able to go through the wall. And so downstream, the organs that are downstream, the kidney, the skin, everything else downstream is having a harder time getting blood flow because concrete wall. Okay, now the heart is a muscle, and any muscle, when you ask a muscle to use extra energy consistently, that muscle bulks up, right? Think about weights and muscle, it bulks up. But the heart is a muscle that we don't want it to bulk up, right? When the heart bulks up, we call it heart failure because it's too big, it's flabby, and it does not have the same ability to squeeze and get blood pumping to the other organs and to even the heart like it's supposed to. And we call that heart failure. Now, downstream, we have the other organs, right? We have the eyes, the kidneys, the sexual parts, we have the legs, the extremities, and when this happens with the heart and there is compromise of blood flow, there is an issue of problems with the organs. So in the kidney, there's kidney failure. In the eyes, we have retinopathy. In the lower extremities, we have peripheral artery disease and peripheral vascular disease. In the brain, there's vascular dementia. And in general, we have neuropathy that's difficulty with blood flow to the body, to the organs, and to the body parts, and these cause these other problems. Now, as a provider, I tell my patients that I am not just responsible for you as a person, patient A. I am also responsible for all the organs that come with you as patient A. So I also have to take care of your heart, your kidneys, your liver, all the organs that come with you. And that means that I have a duty to protect all of those organs. And I tell my patients that I am not pro-medication or anti-medication. I am just pro-patient. Whatever will work for my patient, that's what I recommend. And sometimes what will work for my patient is medication, but not just medication and lifestyle changes. Because medication is just a tool. It is not the only tool, but it's one of the tools. And so we need to make sure that we are protecting those organs. We all know that lifestyle changes do not change things overnight. Lifestyle changes takes a while to get to the point of changes that we want to see. And so while it's taking place, we still need to protect your organs, your heart, your kidneys, all of that. And so you may be put on medication to help reduce your blood pressure. It doesn't mean that you're going to be on medication forever. It means that you're taking care of your organs while you do the work. And so today I just want to bring attention to that. It's a silent killer, and it's not only going to kill you as a person, it's also going to kill your organs. And so it's important that we pay attention to that and do what we need to do to protect those organs. If you would like to reach me, you can schedule an appointment with me at myOrchidWellness.com or telehealth.myOrchidWellness.com. Like I said, I see patients in Texas, New York, Virginia, and DC, but all over the world. I just want you to get educated. Send this to a family member, a friend, somebody that needs to know about blood pressure. If you don't have a blood pressure machine at home, I would recommend that you get one. It's good to just know what your numbers are. So what are the numbers? For elevated blood pressure, it's anything 120 over 80 or higher. Okay, that's elevated. And then when you get to 140 over 90, that is considered high blood pressure that requires treatment. So it's up to all of us to take care of our blood pressures and make sure that we know what our numbers look like. Thank you and have a great day.